If you suffer from low back pain or sciatic pain, I have a miracle for you. Please stick around and watch this video. I don't use the word miracle lightly, and I know it sounds like I'm going to try to sell you something. I'm not. This is free. Now, the thing I'm going to teach in this video is especially valuable to body workers, chiropractic doctors, physical therapists, massage therapists, and the like are going to find that this is of great benefit. But any doctor can and should, in my opinion, learn about this and use it. It's very simple and it's extremely effective, and it can be absolutely miraculous. And you can use it on yourself as well if you are one of those people who have low back pain or sciatic pain. Now, I'm not talking about temporary relief. In most cases, this can help to make it go away permanently. This is something I discovered many years ago. I've used it on countless patients. It's a big world, and surely there's someone else in the world who knows about this, but I don't know of them. I've never read it in any book. It was never taught to me. I've never heard about it. I've never encountered anyone who knows about it. So, for lack of a better name, I call it the Curtis technique. The Curtis technique is easy to do. It doesn't take a lot of experience or practice, and the results, you won't believe the results. They can be absolutely dramatic. It works probably 95% of the time. There is that small percentage of patients that I haven't been able to help with this, but most of the time it works very well, and in most cases it's dramatic, and the results can be seen immediately. In some cases, the pain goes away immediately, and as I said, it's permanent. I haven't really found any limitations to this technique. I've had patients who have multiple disc herniations confirmed by MRIs, and yet they still respond to this. I even had a patient who had had 2 failed spinal surgeries, and he was on disability, and this technique worked on him. Now, he wasn't one of those patients who immediately got well. It took time, and it took multiple sessions, and I taught his wife how to do it, and she did it on him at home, and he was able to get off his pain medications, and he was able to live a normal life. Many of the people I treated with this technique had had cortisone injections, they'd gone through physical therapy, they'd had chiropractic treatments, and many of them had gone to acupuncturists. Nothing helped. I've had patients who had sciatic pain for decades and just had to learn to live with it. Now, I'm not boasting. I just want you to understand that this thing really works, and it's a free gift. I'm not trying to make any money off this. I just want to give this to the world. I want the knowledge of this thing to spread. It's unusual. It will seem very strange to you. Some of you will reject it because of that. There are people who simply refuse to accept anything that doesn't make sense to them. It doesn't make sense to me either. It didn't make sense when I discovered it, and yet I've used it for decades, and it works. I don't expect you to not be skeptical. I would be skeptical too. That's a scientific approach, what I call open-minded skepticism. But I do hope you will try it. So here's how you do it. First, you have to find the spot, the Curtis spot. You go right into the armpit and then go down maybe 4 inches, and then push around, press around. You will find a sore spot. In fact, I would always tell patients, there's going to be a sore spot down here. Tell me when I find it. And patients will say, how did you know? Now, usually it's going to be very sore. And that's how you'll know if you've found the right spot, because it's very sore, but you have to be pressing hard. Now, when you find that sore spot, tell the patient, it's going to hurt, it's going to be painful. Is it okay if I do this? And when you get permission to do it, then you're going to just it's better to use 2 hands. You can use 1 hand and just work around, just press around and move the hand in a circular motion, or you can use, I like to use the fingers of both hands and just kind of pull it apart and kind of visualize pulling the ribs apart there, but there are different ways that it can be done. I usually do it for about 30 seconds. If it's not painful, in fact very painful, you either don't have the right spot or you're not doing it hard enough, because unfortunately it has to be painful. It's just, for a short period of time that they have to endure the pain, and you'll usually know if you're still on the spot by watching their face. Some people are pretty stoic about it and they don't have a lot of facial expressions, and you have to ask them, is it still hurting? Am I still on the spot? But usually you'll be able to tell by looking at their face. People will always ask, what is this? What does this have to do with my low back pain or my sciatic pain? And I will tell them it's very simple. I don't know. I used to suspect it was a neurological connection, but now I think it probably has to do with the fascia. We know as we learn more and more about the fascial layer of the body that it has a lot of functions more than just simply being a covering. But I haven't concerned myself too much with how it works or why it works. I just know that it works. I discovered it because in my practice I would do a lot of rib work, helping people with breathing difficulties, even anxiety, and I'll talk about those things in another video. By the way, I forgot to mention, it's best to have the patient lying on their side. If the pain is on their right side in the low back or the right sciatic nerve, or it could be one of the other nerves going down the leg, then you'll have them lie on their left side and raise their arm. If the pain is in the center of the low back, then do both sides. And in many cases, you'll do both sides. Sometimes, if they have all their pain on one side, you will only find the sore spot on one side. The Curtis spot won't be, you won't be able to find it on the other side. There are different kinds of minds in the world. Some people will look at this and say that's ridiculous, and they will just go on their way. My videos are not for that kind of mind. Other people will say, well, I'm really skeptical. It doesn't seem like this could possibly be true, but they will try it and they will find that it works. Other people will say, I believe it. I believe Dr. Curtis, but they will never use it in their practice. Okay, but the people that really take this and learn about it and run with it, you're the ones who are going to benefit, and your patients are going to benefit. And if you're not someone who works with patients, it's just for yourself, then you will benefit, because you can even do it on yourself.